At this time, the coronavirus and the flu are surging across the U.S. The CDC and medical experts say that both of the infections are contagious respiratory illnesses that have very similar aspects and symptoms.
Without a doctor to tell you, the difference between whether you have the flu or COVID, it's really hard to tell.
For starters, both COVID and the flu can consist of the same signs and symptoms, one of which can be no symptoms at all or common symptoms like the ones listed here.
Congestion, hard to breathe. A lot of people say they lose their taste or their smell. I guess that's probably a way you could differentiate.
Plus, anyone can spread either virus for one whole day before experiencing any symptoms by being in close contact with someone else. Another likeness is older people. Those with underlying health conditions and those who are pregnant are all at risk for having severe symptoms and illnesses.
And I took a PCR test recently when I had Omicron, and that came back positive.
Residents like Isaiah Richards have suffered from both COVID and the flu. He says if he hadn't gotten tested, he wouldn't have known one virus from another.
The chills, the sweats, not eating, woke up in puddles of sweat, and then the chills was bad. I sleep in a sweatsuit with my blanket, and it felt like I had nothing on.
Now, out of all those similarities, there's one major difference, and that's when these things occur. Now, a pandemic is rare, like COVID-19. There's only been 4 in the past 100 years. Now, something like the flu, that happens every winter and fall. In Lafayette, I'm Princess Jeanne Steverson Lowry, News 15.